Consider any operational and physical risks at your
Hello, everyone, and welcome to today's press briefing on the coronavirus. I'm Donna Bush. I'm so glad you could join us via our channels as well as listening on Radio Cayman. We go to Reverend Ed Tatum for today's prayer.
Let us pray. Dear Father, thank you so much for how you've helped us in these challenging times. Thank you for the leadership we have. Thank you for the courageous job that our Premier has done. Thank you for the people who work with him. We pray, Lord, that you would bless them in a very special way and give them your wisdom in your direction and protection. We pray that you would bless the doctors and nurses and help them to do what's best for the ones who are suffering. We pray for the less fortunate ones, the ones who are sick today. Do touch them and help them. In their future, they'll be well again. We pray that somehow, in the near future, we'll find a cure for this problem and we'll be able to rejoice and thank you for a great job that you've done in remembering and helping and blessing us. For we pray these things in the holy and lovely name of Jesus. Amen.
Amen. And thank you, Reverend Tatum. We now welcome our esteemed panelists, His Excellency the Governor, the Honourable Premier, as well as the Honourable Minister for Health. With us in studio are the Chief Medical Officer, the Director of HMCI, and our sign language interpreter. Joining us via Zoom are members of the media, as well as the Medical Officer of Health, Dr. Samuel Williams Rodriguez. We go first to Dr. Lee.
Good afternoon. There are 385 results to report today, 233 from the Doctors Hospital and 153 from the Health Services Authority. They're all negative. It's great to report that for a change today. That brings our total positive unchanged at 193, and including 3 from Cayman Brac, where they have now completed their screening program and have screened 51% of their population. That screening program, the general screening program, is now finished, and they won't be accepting any more participants to that. They will continue to screen their frontline workers as is being done across all the islands. The number of symptomatic people is still at 2, number of asymptomatic at 58, 1 person remains admitted and is stable, and 132 people have recovered. There are 145 people in government facilities, isolation facilities, and 253 are isolated at home. There are 7 patients seen in the flu clinic on the previous 24-hour period, and 3 flu-related calls to the hotline, although they received a total of 11 calls. It's great to see in the news that there is a new drug that is proving to be very effective in the treatment of people with severe COVID disease, and it's a very cheap and widely available drug called dexamethasone, which is a steroid drug. It's been shown to reduce deaths by up to 1/3 and has already received emergency approval for use in the United Kingdom, and no doubt will get that approval elsewhere as well. So something to take note of, we've seen that although New Zealand has been doing very well in terms of managing COVID disease in its shores, 2 people were released early from an isolation facility on compassionate grounds in order that they could go and see a relative and drive 400 miles from Auckland to Wellington. Unfortunately, they met up with friends along the way and then stayed with friends at the other end, but have now been discovered to have had COVID. And so therefore, they are contact tracing 320 close contacts of those 2 people due to their contacts both on the plane, in the isolation hotel where they were, and the people that they met. Additionally, although China felt that it had recovered from the COVID, and we all hoped that they were through to the other side, we all are now seeing in the news, there is an outbreak in Beijing, which is now under lockdown. Hundreds of flights have been cancelled to the capital city, and schools have been suspended, amongst other measures which have had to be reintroduced. So there is no question that COVID-19 is here to stay and will emerge should it be given the chance to do so. Thank you, Donna.
Thank you very much, Dr. Lee. We're going to go first to the Caymanian Times. Ralph Lewis, standing by.
Yes. Good afternoon, Dr. Lee, and thanks for your good report. And hope you had a great weekend. Two brief questions. The first one regards medical specialists. There are some patients on the island that may need specific medical treatment from off-island specialists. Are they allowed to return to the island? What suggestions can you give to those patients?
Many of the people who are current patients of medical specialists overseas are actually being followed up through telemedicine. Those that need to make a physical appearance are going for their appointments, and of course, in particular, that group includes a lot of people who need urgent and complex treatment, frequently related to cancer, that are going abroad and receiving that treatment and then coming back to Cayman. Some were also receiving treatment abroad at the start of when the lockdowns happened around the world, and they actually very sensibly chose to stay where they were in order that they could complete their treatment program. I've also been suggesting to people who go to the States for treatment, particularly if they've had surgery, to please consider a more extended recovery period in the States before they come back, just in case there might be a problem related to the operation, because travel is much more difficult at the moment.
Okay, thank you. And the final question is, are all private clinics allowed to open at this time?
The current advice from the Health Practice Commission is that they should maintain their treatment for urgent cases. It is highly likely that recommendation will change when we go to a level 2 lockdown, which is imminent, and I understand the Premier will be announcing more today. And following on from his announcement, it is likely that the Health Practice Commission, because I've seen a draft, the Health Practice Commission will release a statement to recommend that clinics go back to normal operations, and hospitals as well, bearing in mind, of course, we have two threats to face, so that particularly relates to the hospitals. So they need to think about being able to release capacity fairly swiftly should we have an outbreak of COVID disease or should we have a hurricane.
Okay, thank you very much. Donald, that's it for Dr. Lee.
Okay, thank you, Ralph. We go now to the Cayman Compass. Reshma is standing by. Reshma?
Thank you, Donna. Good afternoon, Dr. Lee. I'm glad you touched on the anti-inflammatory drug. Can you say if this drug is available locally and it's being considered for part of the COVID-19 treatment regimen?
Yes and yes.
Okay, quick answers. I just wanted to get an update
Reshma, it's a really widely available drug. So, I mean, there should be, I'm doubting there's going to be any supply issues. And also, I would imagine that suppliers can ramp it up quite quickly because it's used for a number of different conditions. So I would imagine that that there shouldn't be a supply issue after initial slowdown, but then I think there shouldn't be a supply issue.
Okay, great. Thank you. Now, the drug hydroxychloroquine was found to, well, the FDA withdrew its approval for its use mainly because of the side effects that drug carried with it. Are there any side effects that patients should be concerned about with regards to this particular drug?
It's a steroid. All steroids have side effects. The longer you take steroids, the more likely you are to suffer with side effects with them. But because it's been around, steroids have been around, I would think, I would hazard a guess, coming up to 100 years. We know them very well. It's not like we don't know them. They're well defined. And once you stop the drug, that the side effects will withdraw. So I'm not anticipating there would be a long-term issue.
Okay, great. Can you provide us with an update on the antibody testing at the HSA? Has that started, and how many tests, if it has started, how many tests have been done so far? I'm
not 100% sure. Dr. Williams may be able to provide the answer. I certainly know that they're planning to start both at Health City and at the HSA this week. Whether they actually have done, I'm not 100% sure. We're not planning to give those reports on a daily basis, so if you ask me for them, we'll probably only plan to give them to you once a week. And I will, so I'm just giving you a forewarning about that. Yeah, I think, I'm not sure if Dr. Williams is on the line able to answer whether it's actually started.
Let me ask him. Dr. Sam, are you able to answer Reshma's question for her?
Yes, yes, good afternoon. Yeah, the HSA has not started yet to test the IgG testing. We are the validation process. We are finalizing that right now. We are planning to start later this week, probably either tomorrow or Friday or early next week for sure.
Okay, great. Thank you, Dr. Sam, for that update. You touched on Health City. That was my follow-up question. I was going to ask when would they be able to get the go-ahead from government, but you've already answered that. So
they have had the go-ahead from government.
Yeah, thank you. Okay, that's it from me.
Okay.
Thanks, Dr.
Thank you, Reshma. We're going to go now to Wendy at CNS. Wendy, please go ahead.
Thank you, Donna. Doctor, just a quick question. Firstly, the patient that's in hospital and you're describing as stable, is that patient on a ventilator or needing oxygen?
No, the patient is self-ambulating around the room.
Okay. So they're doing good.
Yeah, as far as I'm aware,
Okay.
they're stable and not needing much assistance apart from obviously medication and being observed.
Okay, cool. I just wanted to check that. My main question really relates to some of the findings in the education report that came out last week, and what the inspectors have spoken about with regards to protecting children when we go back to school. What I was wondering from your perspective, are there plans to test students and teachers?
No, not currently. There are no plans for that. Unless, of course, there's an outbreak, that may change the decision. Our sampling so far, Wendy, has shown that we don't appear to have any outbreaks or clusters that are causing infections widely at the minute. I am really reassured by this. That is why we're moving down the lockdown to level 2 and hopefully to level 1. There's nothing that is, no evidence that's come to me that has made me see a reason not to change that plan. We are not planning to test everybody on the islands. We're continuing to do sampling of the most, what we feel is the at-risk groups, and we are have worked our way very well through those groups.
Okay, cool. So even when school goes back, you don't think you'll be testing teachers?
We might change on that point. I don't currently have a plan to do that. I don't feel the need to do that, no.
Okay, thank you. That's all my questions.
Okay, thank you very much, Wendy. Thank you, Dr. Lee. We're going to go now to our panel, beginning with Premier.
Thank you, Donna. Hello, everyone. Well, following Dr. Lee's report and the also great report yesterday, I think everyone must be anticipating what I'm about to say. I think Dr. Lee sort of indicated that just now, that we are continuing the plan to move to level 2 suppression with effect from Sunday coming, the 21st of June. In practical terms, that means that as of the 21st of June, there will be further softening of restrictions, some starting on the 21st, some starting on the 5th of July, and others on the 19th of July. At 4:30 a.m. on Sunday, the 21st of June, 2020, the hard curfew will come to an end. From Sunday the 21st, persons will no longer be subject to the shelter-in-place requirements or to restrictions on traveling to certain places on certain days based on their surnames. Persons will, however, still be required to maintain social distancing requirements and to wear a mask while indoors in public places where they can't essentially stay 2 meters or 6 feet away from the nearest person. And I know this will be greeted with a lot of welcome. As of Sunday the 21st, there will no longer be a prohibition on persons visiting each other's homes. This also means that domestic helpers and caregivers will be allowed to return to work. The definition of public meeting and the restrictions around the number of persons who can gather will change in Grand Cayman, and gatherings of up to 25 persons will be permitted. In Cayman Brac, has been no change, and there will be no change, and 25 persons or less will continue to be able to gather. Social distancing requirements continue to apply. For absolute clarity, this does not relate to Little Cayman, which has no such restrictions except protocols around social distancing and the wearing of masks in public places. All processions and festive ceremonies, carnivals, parties, dances, concerts will continue to be banned both in Grand Cayman and Cayman Brac, regardless of the number of people involved. Most establishments, institutions, businesses, organizations, and offices, including churches, cinemas, theaters, beauty salons, barbers, spa, and masseuse services, and medical and dental offices subject to approval from the HBC, in the case of the medical and dental offices, will be able to fully operate, but must all observe the social distance requirements and enforce the wearing of masks. These establishments are not subject to the social gathering restriction of 25 persons maximum. They are only subject to ensuring that the distancing requirements are properly maintained and the mask wearing is enforced. However, even though offices can be opened, we are still encouraging businesses and managers, particularly those in the financial services sector, to allow as many staff as possible to continue to operate remotely, particularly if there will be issues with the distancing requirements within offices. Restaurants and bars in Grand Cayman will continue to be able to serve customers on any patio or other outdoor area which forms a part of the premises of the bar or restaurant from the 21st of June 2020, now subject to the following amended restrictions. Each table must still remain at least 8 feet apart, but there are no longer limitations on how many persons may sit at the table, but they must continue to maintain the 6 feet or 2 meter separation. No person shall be seated or served at an indoor counter in a bar or restaurant. Servers and front of house staff shall continue to wear masks or cloth face coverings while serving customers. But going forward from the 21st, restaurants and bars will be permitted to operate within the hours they are licensed so to do. That is within the hours of operation permitted under the liquor licensing law, the Sunday trading law, and or the trade and business licensing law. However, it should be noted that karaoke and dancing are still not permitted at this stage. In Grand Cayman and Cayman Brac, persons will now be able to host or attend a wedding with no more than 25 persons other than the bridegroom, bride, official witnesses, and the marriage officer. Similarly, with respect to funerals in Grand Cayman and Cayman Brac, the number of persons allowed to attend, in addition to the 6 pallbearers, the officiants, and essential mortuary staff, has been increased from 10 to 25. Persons will now be allowed to exercise at any time, but shall be subject to the public meeting and social distancing requirements. Restrictions on the type of activities that may be conducted on beaches will also fall away on the 21st of June, Sunday coming. Persons at beaches will, however, still be subject to social distancing requirements if they are outside the same household, and gatherings of no more than 25 persons. From 21st of June, strata and public pools can be accessed by persons from different households, subject to gatherings not exceeding 25 persons, as well as persons observing social distancing requirements with persons from outside their households. Scuba diving and snorkeling are allowed. However, persons are asked to note that they must not rent any scuba or snorkeling equipment, with the exception of tanks, for any scuba diving activity, including for training in scuba diving or snorkeling. In other words, we don't want you using other masks or as we call them, goggles and snorkels that other persons have previously used. Persons in Grand Cayman will now be allowed to use a boat for any purpose once there are not more than 10 persons on the boat. Persons in Grand Cayman are, however, still not allowed to travel for pleasure by boat to visit Cayman Brac or Little Cayman. Everyone is reminded that they are still not allowed to operate or maneuver a boat so as to congregate or gather with any person or other boat or vessel where the number of persons gathering exceeds 10 persons. That is from the 21st of June. Additionally, the restrictions on persons not congregating or conducting any boating activity in the waters in the areas specified as Starfish Point, Rum Point, the Sandbar, and Stingray City continue at this stage. Persons in Cayman Brac will now be allowed to use a boat subject to there being no more than 10 persons on each boat. Persons in Cayman Brac and Little Cayman, however, are still not allowed to travel by boat for pleasure to visit Grand Cayman. With regard to inter-island travel, the current restrictions remain. Persons in Grand Cayman are not permitted to travel by boat to Cayman Brac or Little Cayman, except for transport of freight to Cayman Brac or Little Cayman. From the 21st of June, a person who wishes to travel from Grand Cayman to Cayman Brac or Little Cayman by air shall, prior to traveling, notify the medical officer of health of the proposed travel, remain at a place of isolation as specified by the medical officer of health for a period not less than 14 days, and receive a negative test result for the virus. That is the new regime from the 21st of June up until the 4th of July. The following changes will take effect on the 5th of July 2020. That is, as we keep reminding people, as long as the current trend of results continues, that we don't have some major outbreak or some reason to do what some, in fact, many other countries and states are having to do. From Sunday, the 5th of July 2020, all educational institutions and facilities, including summer camps and vacation Bible schools, may commence full operations, including social and sporting activities. It should be noted, however, that sporting activities at an educational institution or facility are subject to the requirement that persons not engage in contact sports before the 19th of July. From Sunday, the 5th of July, in both Grand Cayman and Cayman Brac, restaurants and bars will be able to offer both indoor and outdoor services. However, the following conditions will apply. Each table must be at least 6 feet apart, but there will be no limitations on how many persons can sit at a table, and the distancing requirements will be reduced from 6 feet to 3 feet. That is for persons who are not of the same household. Servers in front of house staff shall continue to wear masks or cloth face coverings while serving customers, and a restaurant or bar will be permitted to operate within hours of operation allowed by their license and as permitted by the liquor licensing law, the Sunday trading law, and the trade and business licensing law. In Grand Cayman, persons will be able to exercise in a strata gym and public gym from the 5th of July. And I know this is very important to many people, so I'll pause so that people, I don't just run from one point into the other. From 5th of July, a person who wishes to travel from Grand Cayman to Cayman Brac or Little Cayman shall, prior to traveling, notify the medical office of health of the proposed travel and be tested for the virus. On the receipt of a negative result, the individual will be transported or must be transported directly to the airport for the flight to Cayman Brac. So that everyone is clear, the current arrangements which people have become used to, although they complain bitterly about them, of a 14-day isolation period before you go to the Brac, will continue until the 5th of July. But from the 5th of July, you simply need to notify the medical office of health and have a test done and receive a negative result, and you may go to the Brac. And although this is fairly obvious, I've been asked this by a number of people. The reason for that is that we know as for certain that Little Cayman is COVID-free because we tested every person there. We are fairly certain that Cayman Brac is COVID-free because we've tested 51% of the people there. We know, however, that the virus is still very much among us in Grand Cayman. And we really want to do everything we can to reduce the risk of reintroducing the virus into Cayman Brac and to prevent it from getting to Little Cayman. So although the test just before you go is no guarantee, it certainly goes a significant way to reduce the risk that persons going to the Brac may carry the virus with them. Now, from the 19th, the restrictions or the regulations that I've just described, which would take effect from the 5th of July, will continue until the 19th of July. From the 19th of July onwards, managers or operators of a restaurant or bar may permit customers to engage in dancing or karaoke at the restaurant or bar. Nightclubs may resume operations. Persons may engage in contact sports. And in Grand Cayman, there will no longer be a prohibition on more than 10 persons congregating or gathering with others on other boats, and the restriction or the prohibition, I should say, of boats or persons congregating at Starfish Point, Rum Point, Sandbar, and Stingray City will also fall away. The regulations will continue until the 2nd of August 2020 or until such later date as the Cabinet may specify. However, as I think everyone will be aware, we will continue to monitor carefully what is transpiring. As Dr. Lee has indicated, we continue to watch very carefully what is happening with the result of the testing. We really don't see a great deal of sense in simply going through the entire population, testing every person that would make themselves available. We've gone through all of the are going through all of the various demographics. I think the last ones we're dealing with now are the caregivers and domestics. And then we will circle back and start testing again frontline staff, because if there is going to be an uptick in the infection rate as a result of the reopening of these various sectors and putting more people back into circulation and in contact with each other, we are likely to see it first in the frontline staff, because they are the people who have the greatest interaction with greater numbers of people. We certainly don't want what has happened in many other places to occur here. As I've said, I don't think I have the fortitude to go back into a full lockdown again and to deal with all of this. The news from around the world is not at all good. We have 18 states in the United States of America that have seen significant spikes since their reopening. We have seen what has happened in Beijing. I think the case in New Zealand, they've dealt with that in their usual very effective manner. We want to avoid, as far as possible, the outbreaks and clusters. And that's why we have been so cautious, and we are still being so cautious in the reopening, so that we pause at every 2 weeks and see what the impact of the last reopening has been on the infection rate. So far, it hasn't affected it at all. I think, subject to correction, just off the top of my head, our infection rate is somewhere between 0.5 and 0.8%, which is very, very good, and thus we are able to take these further steps as we are doing now. Again, I want to thank the entire country for, in large part, the incredible cooperation and support for the actions that the government has taken. I think everyone knows, and the government is certainly working feverishly on dealing with the economic fallout from all of this, trying to address the concerns of people about food, shelter, employment, and doing everything we can to stimulate the local economy, get development and construction moving, because that triggers so much of the other activity, economic activity across the economy. And thankfully, financial services is still going well. We're also focusing very deliberately on, although I have to say with not a great deal of success so far, on trying to figure out how we reopen our borders without significantly increasing the risk of introducing a possibly more virulent version of the virus here and undermining the tremendous success we've had so far. But at some point, we must reopen our borders. We can't stay locked down forever. And so we've got to find a way. As we have found a way through this epidemic in Cayman so far, we are confident, find a way to manage that. But again, looking at what's been happening around the rest of the world, I think we are getting more lessons in what not to do than really in what we ought to do. But we'll figure it out. Of that, I am absolutely confident.
Thank you, Premier McLaughlin. Lots of happy people out there. I hear they're popping champagne and all kinds of stuff going on. Your Excellency.
Okay, thank you very much. Yes, it really is very positive, and it's great to welcome that set of announcements. And I really do hope that gives everybody a lift on the islands, and everybody deserves that for all the cooperation and hard work that's gone into where we are today. And I just think on testing, it is worth saying again that this has been an outstanding success of our response. And I think if you look at this global table, we're now up to the third place in the world in terms of tests for the number of people that we have. Of course, we're a small territory, and that's an advantage, but there are an awful lot of small countries and territories in that list, and we're right up there above most of them. So that's very good. But the key part of that story is that it gives us the confidence to be able to move to suppression level 2, because we have such a large evidence base to open up safely. So again, I just want to really reiterate what the Premier has said and welcome very much those significant announcements we've made today. I think it is the case that there is still so much uncertainty and complexity out there in the world in dealing with COVID-19. We've heard already about China and New Zealand, but you just have to look at South America, South Asia, and what's happening in the States. There's some really difficult situations out there, but we at least have got ourselves into a very positive position. And I think, as panel members have said before, government measures are reducing all the time, but the onus is now on each of us. It's individual responsibility. We really do have to keep going with social distancing, keep going with basic hygiene and good respiratory behaviour, and wearing masks in public. And that's really important as we continue to move forward and not let our guard down. And I do also just want to say that the border clearly remains our big challenge, but nobody out there has got all the answers to this. But we're watching very closely what others are doing, and there's a lot of work going on to work out how we can safely open our borders. So let me just say a big thank you to all of you again for your cooperation in helping get us to this place. And then finally on COVID, I also, as John Lee said, very much welcome this new drug that's been trialled. But I do want to underline this has been trialled in the UK. It's actually Oxford University which is responsible for this. So again, underlining the UK's very strong science base, and there's lots of work going on vaccines in the UK, and there are trials in the UK for rapid tests. So we're keeping a very close eye on all of that. Secondly, I want to just say that I'm now very pleased to say that on evacuation flights for India, we will have a flight to Chennai on the 3rd of July. Now, this has not been an easy flight to arrange with the Indian government because of stringent requirements for personal protective equipment on the flight. But we have arranged for British Airways to come here and fly Indian nationals to London, and then using one of British Airways' partners, Qatar Airways, they will fly those Indian nationals on to Chennai. We will arrange a second leg, a second plane to do this if there is sufficient demand there. So we want to just test demand over the next few days, and details on how you can book on this flight will be released very soon. And let me just underline again, this flight is only for Indian nationals. We also remain in discussion with BA about 2 flights to London in August for students and families who need to go to the UK, probably the first week in August and the last week in August. And again, we will release details of those just as soon as we can. I want to give another shout out for the Cayman Islands Regiment, because the deadline for recruitment ends on Sunday the 21st. As you know, we're recruiting 50 part-time reservist positions. We've had over 250 applications, which is really positive response. I continue to encourage even more Caymanians to apply, and I would like to thank our UK military assistance team who are helping us sift the applicants and helping design a 2-week training course for the new reservists. And I'll leave it there today. Thank you.
Okay, Great. Thank you, Your Excellency. Minister of Health.
That was quick, though, huh? Good afternoon, everyone. Grand Cayman, Cayman Brac, Little Cayman, and our Caymanian diaspora listening in. Thank you, Premier, for those announcements. And we must know that some will say we are moving too slow, and some will say, hold on, you're moving too fast. We hear it every day, and yet we can still be proud as a nation that what we did, fast or slow, was somewhat the right decision to ensure that everyone appreciates that we were very deliberate and caring about all lives in the Cayman Islands. We have to thank God for his mercies and for guiding the people that he selected for office to run this country. Maybe some will look back and smile at what we did and say thank you. You've just heard the Premier announce all the new measures, and I'm kindly asking to remember that face masks and washing of hands will be very important for a little while longer. Some of us known each other from childhood days, went to primary school, middle school, high school together, and has never been apart from each other for 3 months. And your first reaction is to hug that friend or to get lovey-dovey, as we would say. But I'm asking you to just be a little patient as we figure out things and learn from the world how we should or should not go about the new norms of today. Remember, there are no experts of COVID-19. Every day, they're learning something new about Corona. I know it's hard not to give that affectionate Caribbean greeting, but if you feel pressed to do so, get in and get out quickly and step back in your safe space. We never want to go back in full lockdown or have a major breakout. Thank God, indeed, we are not like some countries trying to play catch up. Scripture reading for today is Psalms 100, 1 through 5. Make a joyful noise unto the Lord, all ye lands. Serve the Lord with gladness. Come before his presence with singing. Know ye that the Lord, he is God. It is he that hath made us, and not we ourselves. We are his people and the sheep of his pastures. Enter his gates with thanksgiving and praise. Be thankful unto him and bless his name. For the Lord is good. His mercy is everlasting, and his truth endureth to all generations. May the Lord add a blessing to the reading of this word. Shout outs today. I want to thank those of you who prayed and are still praying and fasting for us. The angels are smiling on you. I want to say Dejanay Joseph, Ian Berry, Nellie Pucci, Anne Smith, Tiffany Seymour, Jasmine Robinson, who has a sweet 16th birthday today. Your mom, Natasha Powell, wants to wish you a happy birthday, but I wish all of those names I just called a happy birthday. Stay safe. We're still getting a lot of calls, and I thought I might mention publicly the walking tracks. They're actually open. I understand that some of the padlocks are still on the gates. We've discussed this in our caucus, and this should be addressed very, very shortly. Only the National Stadium, Truman Bodden, is not supposed to be open. So we will follow up further on this, but we've already made some progress in trying to ensure that the walking tracks, are made available for persons walking in the afternoon. We are a blessed country. We ought to thank God for his blessings and mercies on us. I know some are feeling more comfortable with the way things are moving as we continue to move towards fuller reopening our local economy and being able to be more social. I pray that you will keep in mind that even though many restrictions have been eased to date, that you will continue the recommended prevention measures and to protect each other. Do not lose your sense of responsibility for the health and lives of your family, your friends, and community. Let us not all become complacent at this time, at this critical time. I'm proud to be a part of the community that has shown our strength and resilience despite the challenges and struggles we are indeed in the world have been facing. I urge you to continue to pray for your leaders in government, in the public service, in private industries, and in science and in medicine. We are a country that have much to be thankful for. I'm reminded of that daily as I see the hard work and knowledge that is brought to the table every single day. As Minister of Culture, I want to say how proud I am to see how Caymanians and residents have truly shown their Caymankind attitudes. Caymankind may be a new term, but the Caymankind spirit has been around throughout our history. We are an incredible people who have shown that little axes cut down big trees. On that note, as someone who is proud of our maritime history and proud of our motto, "He hath founded it upon the seas," I wanted to also highlight yesterday's celebration of World Sea Turtle Day. As many may be aware, the Cayman Turtle Center has planned 2 green sea turtle releases to mark World Sea Turtle Day, and as a part of the continuing its conservation efforts, 5 yearling turtles were released into our waters yesterday, and another 5 will be released tomorrow. What better way to celebrate the animals that provided sustenance for these islands agriculturally and economically throughout our history? Tomorrow's release will once again be done virtually due to the COVID-19 restrictions. It will be live streamed on the Turtle Center Island Wildlife Encounter Facebook page beginning at 9 a.m. I encourage you all to sponsor and name a turtle. You can learn more at www.caymanturtles.ky. The facility has been releasing turtles consistently for decades now, and a recent press release from the Turtle Center revealed to date that it has released more than 32,000 of its captive bred sea turtles into the wild. Also, it is indeed a joy to hear that the Department of Environment has reported an increase in turtle nesting, primarily due to the lockdown measures and decrease in human activity on our beaches. This is but one silver lining to the dark cloud that is the COVID-19 pandemic. I congratulate the hard work of those involved in this conservation effort over the years and pledge to support the continued educational and cultural aspects of this very important work happening here in the Cayman Islands, a place I am so proud and most humbled to call home. It would be remiss of me not to mention the passing of one of our The country mourns the loss of one of its greatest entrepreneurs who built the Tortuga Empire into what it is today. I want to take a minute to honor Mr. Hamity's contribution to the Human Tissue Transplant Council. As a member of the council and leading advocate, he played a pivotal role in the tireless work needed to get our own tissue transplant capabilities here in the Cayman Islands, which will very soon come to fruition. Though we are saddened he will not see the first transplant take place, we are grateful of the opportunity to have worked with him. He's left behind an indelible legacy which encompasses more than just the rum we all enjoy. Mr. Hamity had a passion for organ transplants, as he too was a recipient of an organ which helped save his own life for many years and hoped that it would help save many, many more. To his family and friends, you are in our thoughts and prayers through this very difficult time. I thank you and God bless you.
Thank you very much, Minister of Health. I'll begin with questions today before we go to the media on Zoom. Just some clarification from your announcements, Premier McLaughlin, on various things that are opening, such as churches. If you could clarify the issues with churches, what they will be able to, can they go back at capacity? It's just clarification. People are missing some of what you've said, and they just want to make sure, some of the pastors want to make sure that they can open, they can open, how many people, that sort of thing.
As they say, repetition bears emphasis, right? So churches are not subject to the 25-person gathering restriction, but they are subject to the restrictions or the protocols with respect to distancing. So depending on the size of the church will depend on how many people are lawfully able to gather from the 21st of June going forward.
Okay, sir. Yeah. Staycations.
Staycations are permitted as of the 21st of June.
Okay. Preschools.
Preschools, yes. Working from my memory here now, but I don't want to give people the wrong date. Yes.
Yes, July 5th.
Yes. Yes, educational institutions and facilities from this 5th of July.
Okay. I think you mentioned strata gyms, but all gyms can open from a certain date as well?
Yes, all gyms from the 5th of July.
As well. Okay. And finally, contact sports, such as
19th of July.
rugby and all that. Okay. Okay, so we're good. I think I have one. I do have one more thing to say, just to the listening public, for those who are not getting everything that you're saying, that they can just go online to youtube.com/CIG television and re-listen to the remarks made by the Honorable Premier, and then you'll get it there fully, rather than having to ask the same questions over and over again. Flights to the United States, Miami in particular, do we know anything on those, or should persons contact Your Excellency, Cayman Airways, to find out?
I think contact the students. They're definitely looking at flights for students, and there are some Cayman Airways flights announced, but not beyond about the next few weeks. But I think they need to speak to Cayman Airways, and responsibility for those flights has now passed to the Premier's Ministry, Employment and Border Control, and CBC. My office is focused very much on negotiations with foreign governments and the BA flights.
Okay. Somebody did have a question about students who will be returning to school overseas. Will they be tested before they go? Is that a norm? Do we know, Dr. Lee? Is it a norm to test students before they leave to go back to school? Okay, the answer is no. It's not something that's done. Okay, that's all the questions for me.
Well, just going to say that would be part of the protocol of the country they're going to. And for most countries you go to now, you're going to wind up in an isolation facility. We're trying to work, I think the governor has something good to say about that, but for the UK, because of the incredible record of not just Cayman, but the other overseas territories, we are hopeful we will have an exemption from people traveling from here to the UK. But otherwise, in the case of the UK, you're supposed to go into self-isolation for 14 days.
Okay, we have any word on the U.S., how that might work on that end?
I think it's self-isolation in the U.S. as well, certainly in Florida.
Okay, that's very important, because I think a lot of students out there are thinking they can just get off the plane and go back to school. Okay, thank you very much for that. We're going to go first to Ralph at Caymanian Times. Ralph, please go ahead.
Good afternoon, members of the panel. Good afternoon, Mr. Premier. And my first two questions are for you. And thank you for the good news. And you'll probably notice a little smile in my, on my face. First question: will the competent authority now be closed?
Yes, with effect from the 21st of June.
Very good. Okay. I have some questions from those who are planning carnivals, just to clarify, what day will carnival be allowed?
Not until we get to level 1 suppression. So assuming things continue as they have been, sometime in August, I would hope.
I think that gives them time with their planning. And the final question: how do you feel being able to give the good news today?
No, I'm absolutely delighted. I mean, we've been working at this so long and so hard that you reach a point where you're not really overjoyed anymore. You're just pleased, really, that you managed to achieve this. I think that's where we are. I think one day, when we're all able to look back at this, I think we might have a greater sense of what we've achieved. But right now, we're still very much in the trenches. This is but one phase. I say to my colleagues, I think we've won this round with Mr. COVID. But as we look around the world, it is quite possible that there will be another round, or another round, or another round. And the great challenge, as I mentioned before, looms large in our thinking, our consideration, which is how do we reopen the borders, and how do we manage to sustain this economy and our people in the meantime. So, not a great deal of time for celebrating, because we are far from having won the victory.
Thank you. Thank you. My next question is for Mr. Seymour. Mr. Seymour, thank you for your presentation today as well. Regarding the musicians, as you know, I'm a DJ, and some of the musicians are getting ready to go back to work. As you know, they've been off for quite some time. Some of us provide background music, as you know. Can you confirm when these musicians will be able to go back to work?
Background music. I'll have to background music with DJs playing.
Yes, that's allowed.
That's allowed from the 21st.
Although you have to be careful, because Caribbean people find it difficult to hear that music and don't dance, but no dancing allowed for right now.
Okay, thanks for clarifying that.
But since you mentioned the musicians, the deadline is actually this Friday, and we're trying to contact as much people as possible. We had about 50-something people that never sent in a form and signed it. We've contacted almost about half of them, but there's still a considerable amount of people, or musicians, who have not sent in a form. So if you haven't received your check by now, it means you probably haven't filled out your form. So please do all possible to email it to sharon.roberts@gov.ky, and everything should be okay.
And staying on the topic of music, and I look at musicians and entertainers on the same platform. As you know, there has been some concern that our local musicians do not get enough airplay, do not get enough opportunities to work in our local market. I think this is an opportunity right now with post-COVID era to kind of put some emphasis in that area and ensure that our local musician entertainers get some opportunity to really display and develop their skills. What is your concern regarding that?
Well, I'm a big supporter of that. I've hosted many programs myself in terms of ensuring that local musicians get exposure. And, I've met with Off-Reg and some of the radio stations, trying to get more airplay for local musicians, which have some good caliber music. We haven't reached a conclusion as yet, but it definitely is something that is one of the pet peeves of mine, and we have to bring that to some resolve. Such a small island like this, with the amount of talent that we have, we have to ensure that that is heard.
And thank you, Minister. And I'll make way for my other colleagues who I'm sure have a number of questions. Thank you very much, Donna.
Okay, thank you, Ralph. We go now to Reshma at the Compass.
Thank you, Donna. Good afternoon to the panel. My first question goes to the governor in relation to the flight for the Indian nationals. Can you say what the capacity is going to be like for that flight, and if UK visas would be required, or it's just going to be a quick exchange of passengers when they get to London?
Yes, it's about 300 people, and we've already been speaking to UK Border Force about transit visas. So that's been that has been resolved. They will have to change aircraft in London, and it may go the next day. But all those details are currently being worked out, and we'll confirm that very soon. But it will be the 3rd of July leaving Cayman.
Okay, great. I had a quick a question come in asking if the flight that flight is not filled, would you accept say students who need to go back to the UK on that flight?
No, that flight's just for Indian nationals. We're working on flights in August for students, so we'll keep those two separate.
Okay, great. Thank you. This is a question of clarification for the Premier. As we move into the next phase, is there any requirement for domestic workers, helpers, beauty salon employees, etc., to be tested before they get back out to work?
No requirement, but we encourage it. We are in the process of testing about 650, I'm told now, but there's no requirement. We're not testing everybody that goes back to work anywhere. We're doing samplings. As I said before, there are about 5,000 persons with best we were able to estimate within that broad category of caregiver domestic. So we're not going to try to test all of those.
Okay, great. Thank you. Now, a point of clarification as well in relation to the rental of dive equipment. Can you say at what point in your timeline that will be allowed?
I think when we get to level 1, which would, assuming we don't have to pause or to roll back any of these liftings, I'd say probably somewhere around the first week in August.
Okay. Now, you touched on it in your presentation, but you didn't, unless I missed it, you didn't give a timeline for the border reopening. I know the governor said, and you've said as well, it's
still 1st September.
Okay. Still
that's actually been ordered by cabinet. So unless something comes around to cause us to change it, that's the date we're all working towards.
Okay, perfect. That brings me to my next question. Now that we're working with a specific date, where are we in terms of travel protocols, requirements for those returning to our shores? Have you gotten to that point of discussion?
Well, that's what I was saying at the beginning, is that we are working, but there is little in terms of encouragement so far about any truly safe way to allow international travel to resume. So everywhere in the world is dealing with these challenges, So, and what's happening in the U.S. in particular now is hugely discouraging. Instead of the infections going down, they're climbing steadily. And we look around the region. Brazil is probably going to go through the 1 million case mark in the next couple of weeks, and that's only the people that they tested. They're not out doing what we're doing, chasing the virus down and screening. So you can believe the actual number is significantly more than that, and the numbers of people dying from the virus worldwide continue to climb. So there isn't a great deal of encouraging stories around. New Zealand being probably the one that stands way above everywhere else in terms of how they operate. But again, they have proven that they have challenges when they open their borders as well. So this is a massive challenge. We're looking at various ways to possibly reopen the borders, but again, it comes down to either the discovery of some medication which basically turns the virus into nothing much more than a bad flu. There'll be people who say, and I read a lot of this stuff, they compare our infection rate with that in the United States and say it's about the same. which is absolute nonsense. Obviously, they're only testing people that are sick or have symptoms, so they have really no idea, right across the United States and across most of the world, what the actual numbers are of people who do have the virus. And while the virus doesn't prove to be a killer, really, with respect to young children, the mortality rate for persons, over 70 is quite significant. 27%, I think Dr. Lee was saying to us this afternoon. I'm not sure we are ready to run that sort of risk in this country. In this country, it's not just black lives that matter and white lives that matter. Every life matters, and that's a principle that we've upheld, and that's one we are going to continue to.
Okay, thank you for that. Maybe it's premature to ask at this point, but naturally you would expect that people who want to return to our shores want to know if they'll be have to isolate for 14 days, what sort of restrictions they will be subjected to. Are you at any point, are you at that point where you can even give us a little inkling of what government is looking at when we get to that stage?
Well, at this stage, it is still, you need to isolate in a government-run facility. We are looking anxiously at measures that we could possibly employ where we could have some confidence and certainty that persons who are in self-isolation are actually self-isolating and not popping out to fosters because they feel perfectly well. So we are looking at those. We've seen one or two encouraging ways that might be possible, but we certainly are not there yet.
Okay. Now, you touched on summer camps, which I'm sure parents will celebrate for, but do you have a timeline on when schools itself will reopen, or a formal decision from government on what's going to happen with schools? Are they going to restart the year? Are they going to continue on to the next grade? Can you share that with us?
As far as I'm aware, certainly the government schools are expected to reopen as scheduled. And while I know there's been a lot of talk around it, I do not believe any decision has been taken to essentially, as has been suggested by some people, essentially write off the 2018-2019 school year and start all over again. I do not believe that is what is being proposed.
Okay, now the Minister of Education was on Radio Cayman today. Is there any particular reason why she's not joining us on the briefings to answer questions in relation to education? I know we've asked a couple of times now to have her on. I'm just curious.
She's been on twice.
Since that time, we've asked.
Anytime there's a request, we accommodate it. She's been on twice, so it's really not fair to say she doesn't come on to the briefing. She's been on twice.
I didn't say that. Apologies if it came across that way. I just asked if there's a particular reason why we didn't hear from her recently.
Because she's been on twice. If there is a request that you want a special session on education, we did one on pensions. We've done two on education. We've had the Minister of Finance. We've had the Minister of Commerce. Anytime there is a particular focus by the media on a particular area, more than happy for the minister or whoever else can help answer the questions to come. You just need say so.
Okay, I will put in that request then to have education specific questions.
We'll do that tomorrow. We're going to have someone from work. I think it was Wendy who requested that, so we'll have someone on, not tomorrow.
Friday.
Friday. We'll have someone on Friday to deal with those issues.
Great. Thank you very much. One final question from me. The Department of Tourism recently released some sanitation guidelines. I'm just curious, how are these guidelines going to be monitored and by whom?
Well, I would expect they would be monitored by the usual range of inspectors, because the Tourism Department, the Department of Health, public health, all of those are used to dealing with these issues when it comes to the various establishments here that that accommodate visitors. So they have to meet very high standards, and they go through a set of inspections every year. So the systems are already in place to ensure that those things, those protocols are met. We don't have to go and invent a system to do that.
Okay, great. Thank you. That's it from me for today.
Okay, thank you, Reshma. We're going to go now to Wendy from CNS. Wendy, please go ahead.
Hey, Donna, thank you. Can I just follow up with the Premier quickly on some of the things that he's just said about opening the border? When he talks about opening, still targeting the 1st of September, Premier, are you talking about sort of general, like homeowners, people like that, or are you talking about tourists coming back on the possibility of tourists coming back on the 1st of September?
1st of September is tourists or visitors generally. The issue with persons who own homes here or have a second home here or whatever is a separate issue which we are grappling with quite distinctly from. That one's actually easier to manage than persons that come. You might have heard the story, come to visit. You might have heard the story. I won't call the name of the regional country that had the experience with American Airlines flying in 8 or 9 visitors last week, and 11 of them testing positive, and they have wound up in a government-run isolation facility. That's how they're spending their vacation. So I'm not sure what's happening with the others who would have been exposed, perhaps, to those persons on the flight and coming through customs, immigration, and so forth. But those are some of the challenges that just reopening to tourists pose, and we are taking the time to pay attention to what is happening elsewhere, as I say, to see and try to learn some of the lessons from that way. No country has yet found a safe way to reopen to international travel, I think, is the bottom line.
So in other words, we're not talking about a sudden influx of tourists that, especially coming from America, where 80% of our visitors are from America. And I mean, as you've rightly pointed out, the level of the virus spread there is unknowable, but it's a lot worse than ours. So I'm just checking that you're not planning on that isn't a realistic goal, that tourists are going to be coming back on the 1st.
Well, that's I mean, we had to fix the date, and we fixed the 1st of September some months ago, a couple of months ago now, and that's the date we're working towards. Now, the closer we get to it, the more we have to look again. We remain hopeful, but as I've said before more than once, I'm not terribly optimistic that it is a date that we're going to be able to get there. But we are working towards that date with some of the hotel owners and so forth, because everybody's anxious to reopen. So we are working feverishly to try to find what is available in terms of testing. How quickly can you turn these tests around? I mean, at some point we're going to have to take some risks. We just can't stay in lockdown forever. But we want to know what the risks are and come to an acknowledgement amongst ourselves that it is an acceptable risk in the circumstances. We certainly haven't discovered one of those systems yet.
Right. Okay. The other thing, obviously, I think people will need some reassurance on is the situation with cruise tourism, because a lot of cruise ships are still insisting that they're coming here because of the fact that the borders open in September. So presumably that's going to be even more difficult to handle in the future. So what do you feel about the return of cruise passengers?
I don't see cruise returning anywhere in the region, quite frankly, before next year.
Okay.
Yeah.
Okay. My other question relates to the National Conservation Council and the DOE report, which was it's more a paper that was published this week about sort of potential recommendations for us to take a different look at how we rebuild the economy post-COVID. I just wondered what your thoughts were about that document, and also whether you think that government could adopt some of those recommendations.
Well, I think some of them, I kept looking in it for how we're going to feed our people and keep roofs over their head in the meantime, but I didn't find anything relating to that. But yes, I mean, there are some observations and some recommendations which I believe that we really need to look long and hard at. But as I say, you know, these goals, while in many instances very laudable, are in many cases a bit idealistic because they don't take into account the fact that you have thousands of people now who are simply without a job. And we have to find a way as a country for them to be able to make a living and to feed themselves and send their children to school while we look at some of these other things. But I mean, I certainly, I probably won't be around, but I certainly think that this has given us a chance to look again at a range of things. I mean, it talks about sustainable tourism, but I'm not sure that their definition or interpretation of sustainable tourism is quite the same as mine or the government's, because sustainable tourism, to me, also must include the ability of local people to earn a living as a result of the tourism product that you create. Stay-over tourism has been a massive failure for Cayman in that regard. 70% of the persons who are engaged in sustainable tourism in Cayman are expats. So while I agree entirely, that puts a much less strain on our infrastructure and on our ecology and on the roads and all of those things than cruise tourism. And there's definitely a very ugly side to cruise tourism. You know, I'm not sure that stay-over tourism in its current form is really the best thing that Cayman has ever seen, because we have not found a way for it to really work for the vast majority of people who are employed in that industry. So this thing needs a long and critical look, and I think a lot of preconceptions need to be put to one side when that clinical analysis is done. A lot of people are making a lot of money out of stay-over tourism, but not many of them are Caymanian.
But isn't that something that government can address through policy and work permit systems?
Well, when it's not just about work permits. I mean, simply withholding work permits is simply going to prevent businesses from being able to operate. So it's not, you know, this isn't some rant by me of saying, you know, Caymanians should be doing those jobs and why are the foreigners doing them. The reality is that over time, and this hasn't just happened in 4 or 5 years, this started happening from the time I was a youngster. That, you know, Caymanians, for one reason or another, began to become a much smaller percentage of the people who engage in stay-over tourism. And so I think we, as a country, but billions of dollars have now been invested in infrastructure to deal with stay-over tourism. We've just got to find a way, I believe, to make it work for our people, because most Caymanians are not the owners of these facilities, and the salaries, the wages paid to people in stay-over tourism are so low that most Caymanians won't do those jobs. So it is a very complex set of factors operating. I mean, I think about this sort of stuff all the time, and I think what COVID-19 has done for us really is to give us a chance to pause and think again about the whole picture in terms of Cayman's economy, because when you're running so hard all the time and you can't possibly think of doing something that is going to cause people to lose income. It's difficult to make those sorts of changes, but now we've got thousands of people unemployed, hotels are shut down, condominiums are shut down, and we're shuttling hundreds of expat workers back home because there is no work for them here in that industry. I said to one of the bigger operators last week, I said, how do we find a way to get Caymanians to take up those positions, when we slowly reopen? That, I think, is the big challenge and the big question. It's not as simple as saying, oh, there are no jobs here. There are not many jobs here, so Caymanians must have those jobs. Well, only if Caymanians want the jobs in the first place, and then only if they can do them in the second. So it's not as simple as many people like to present it when they call the talk shows.
Okay, thank you very much for a very comprehensive answer. I just have one final question, and this goes back to an answer that you gave regarding agriculture and food security. I can't remember whether it was the last briefing or the briefing before. What I wanted to follow up on was that, yes, obviously, growing produce is very expensive, land here is very expensive, so growing produce is very difficult. But what we do seem to be quite good at is the sort of luxury, kind of fancy stuff, like the hot peppers, pepper jelly, Cayman sea salt, the more sort of, products that are manufactured here, craft products, and there's a lot more coming onto the market. And I was wondering whether the government could assist with the export of those things collectively, and whether the governor's office, even with the UK, could maybe help increase that side of our production when it comes to food and a new sort of area of industry.
Yes, I mean, as one who's been around farming all my life, at one level or the other, it is very difficult to make much when what you're selling is the raw product or raw produce. Where you can actually make money once you got the systems in place and the expertise in place is the value added stuff, where you actually, as you say, you convert the raw product or produce into something else that you can actually sell for a lot more money. There is some of that that's going on here, a sort of cottage industry level, but not a great deal of it. I suppose that is a possibility. But again, the cost of labor in Cayman always is going to mean that the price of what you sell is going to be quite high. And so it has to be a premium product, that's almost sort of a boutique kind of product that people are prepared to pay premium prices for, because you can get things like pepper jelly and those sorts of things at much lower rates in places like Jamaica and across the region. I know because I've seen them, bought them myself. So, but it is, if my bandwidth would allow, I mean, it's one of the things I'm keenly interested in. Maybe I can beg somebody in some other government to come back as Minister of Agriculture or something.
Okay, thank you for that. Appreciate it. Those are all my questions, Donna. Thank you.
Okay, thank you, Wendy. I do have a few questions before we wrap up. Helpers going back into homes. If someone wants to have their helper tested for whatever reason, do they have to pay to have the test done?
No, government doesn't charge for any of the testing that is done. But it has been quite regimented about the areas that we are, because we were working towards a plan. Right. So unless somebody there was some clinical reason why the person needed to be tested, if you didn't fall into that band, they weren't doing it. I know they're doing that sector now, but I'm not sure if they've had enough volunteers. But maybe Dr. Williams or the CMO can speak to that.
Dr. Lee.
There is a link on the government website, so I haven't checked myself that it's there, but I understand it's there, that if you are a touch therapist or a carer for a vulnerable group, you can present yourself put your details down in order for you to get tested if there's some reason that you feel that you're looking after people who might be vulnerable.
Okay. Thank you very much, Dr. Lee and Premier McLaughlin. Exemption letters for salons and so forth. Did you mention anything about those? Will they be required anymore to contact curfew time?
No, nobody will need exemption letters after the 21st.
All righty. Just wanted to clarify that for sure. Your Excellency, any updates on flights to Jamaica, and then any updates on the July air bridge to the UK?
So I think Jamaica, there have been a number of flights already, and clearly the situation is easing in Jamaica. So I think there will be more flights planned. That there won't be a separate July air bridge to the UK. We've just got the two. It's the two in August for students. As I've got the mic, can I just say that the Indian community are obviously wanting to know how to book tickets. Just ask them to be patient for a day or so. Details of how you can book will be released soon, but there's no need to ring my office or contact the helpline until we make available details of how to book. So just ask for a little bit of patience there. And again, a question about the Nicaraguans. I do very much understand the very difficult situation of the Nicaraguan community, but just to say again, we have restarted negotiations and we're doing everything we can.
Okay. Any final words from the panel?
I got two final requests for birthday wishes. We welcome someone in their teens, 13-year-old Araya Adam Cotterell and Isaiah Bodden from the Miles, Moulton, and Oliver family. Happy birthday to you all.
Happy birthday to them. All righty. Well, we thank you, the public, for joining us for today's press briefing, and to our esteemed panelists as well. A reminder to go online to gov.ky/coronavirus if you'd like any information on what's happening as it relates to coronavirus. Also remember, if you'd like to take a look again at the remarks made by our panelists today or by the Chief Medical Officer, you can go online to youtube.com/CIG television. We hope that you'll join us again here on Friday. Until then, be safe. And for those watching television, now you can take a look at today's world and regional statistics.